My name's Thomas Whitelaw, and I was a full-time carer for my magnificent, kind, caring mum, Joan Whitelaw, who passed away on the 22nd of September last year. My mum had vascular dementia, and I was a full-time carer for my mum for 6 years. I came back to visit my mum in 2007. I travelled, I worked in music and travelled pretty much 10 months of the year. And came back to visit my mum for the same reason that most sons come back to visit their mums. My girlfriend had left me, she'd flung me out. And the first place you go is you go back to your mum or your dad, no matter how young or old you are, because they make things better. They take time to listen, and they understand, and they put an arm around you when you need it. And I came back then to visit my mum. And for the first time in my life, I had to try and put my arms around my mum. For the first time, everything had changed. And I had to try and give her the kindness and care that she had given me all my life. But even when I first came back, I was taking 3 months off. My work was flexible. I was taking it off for me to get over my girlfriend leaving me. But also because I was a bit burnt out with my job. I'd been travelling for 20 years, pretty much 10 months of the year. But I have to say, when I came back, it was the beginning of 6 years of heartbreak, joy. My mum brought me joy, struggles, loneliness, isolation, and a lack of understanding. A lack of understanding from within me, because no one ever told me about dementia. I had no clue about dementia, and I certainly never knew who or what a carer was. And even during that 3 months, I was still planning to go back to work. But in amongst finding my mum writing her name in her arm to remind her who she was, and notes under her pillow to remind her that that man in my house is my son, was the beginning of both of us becoming lonely and lost. And 3 months became 6 months, became 9 months, and after a year, in a moment of clarity, my mum asked me a question, and to please don't put her into a home. That was the word she used, and I tried to make her a promise that I would give my mum the care she needed in her own home for as long as I could. And then after a year, became the second and the third year. And at the end of the third year, as dementia was doing everything in its power to affect my mum's greatness, to affect her being recognised as Joan Whitelaw anymore, to affect her being part of her community, to being viewed just as a person with dementia, we were both falling apart together. There was 2 people in our house, lost, lonely, isolated, and desperate for help. And I reached out that day. One day, we got up and I reached out to try and get help. And I took my mum on the bus, and I was 47 years of age, and I cried. I held her hand and I cried the whole journey on the bus down to a health centre to ask for help. And I walked up to the counter crying, a grown man, and my mum was crying because I was crying. And I asked someone to help us. I told them I didn't know how we were going to get through that day to get through tomorrow. And the response was to hand me a post-it sticker with an 0800 number on it. And I was told we don't have to do face-to-face engagements. You must go home and make an appointment. But the problem with that was that everybody in the bus was staring at us. Everybody in the waiting room was staring at us, and we were sent back out the door. And I didn't know what I was going to do when I got home. I didn't know how I was going to continue to care for my mum. But something changed that night. I found a bit of myself that had been lost for the last 3 years. I found a bit of myself that my mum always told me that I could be, that I always tried to be. And I started a campaign from my bedroom, asking people to write to me. I started a blog and organised a walk around Scotland, around Scottish towns and cities, not to raise money, but to raise awareness. And I asked people to share their experiences with me, good or bad. And if they sent them to me, I would walk to the Scottish Parliament and ask them to read them. And they sent me them in their hundreds and hundreds and hundreds. And every single letter I received had the word love in it, or it was written with love. And it had that word once, twice, or 3 times, but it was matched with loneliness, isolation, and understanding. Please help me understand what's happening, or no one seems to understand what we are going through. And these letters, and every single one of them, are not a petition, they're not a protest, they're a love story. My mum's life is a love story. And we in this room and in society should be encouraging and supporting love stories and helping people to achieve that. And I collected those letters because in the letters there was this word of engagement. The people I engage with are putting me off. The people I engage with won't listen to me. And the difference between the letter when someone engages properly and gets it right is glorious. But the reverse is dreadful. And I collected those letters because somebody sent me a letter one day. I was speaking earlier about my girlfriend who, I don't want to keep going back to her, my girlfriend who left me. We'd been going out for about 8 years and we both travelled, we both worked in the same industry. And over that 8 years, she kept trying to speak to me. She kept trying to, I'm sure you've all given someone a wee list of I had to grow up, had to get my act together, I had to listen. We're getting a bit older. I want to settle down. I want to have children. And the more she shouted at me, the less I heard her. The more she tried to discuss it with me, the less I listened. The more, in the most intimate of moments when she pleaded with me, I always managed to say the same thing. When I come back the next time, I'll fix it. We'll make it better. And I got away with that for far too long. I got away with that for 2 or 3 years. And in my last trip before coming home to visit my mum, to become my mum's carer, I was going to America and I opened up my suitcase and there was a letter in the top of it. And everything that she tried to tell me for the last 3 years was in that letter. Everything she pleaded with me or tried to speak to me about that I had pushed aside was in that letter. And my inability or unwillingness to listen to how my actions were impacting on someone I loved lives was dreadful. And she was absolutely right. Everything she put in that letter was the truth. And my lack of engagement, listening and understanding was affecting another person's life. So that's why I wanted to collect letters, because I felt if I can understand a bit more about me, maybe the people we engage with will understand a bit more about their actions towards another human being. And I want to speak about a couple of the people who sent me letters. 2 sisters got in touch to say, could I come and visit them? Could I come and collect that letter? Because it was too tragic. They didn't want to just send it. They wanted to meet me and explain to me about their mum. And I got the train through one day and I knocked on their door. And as the door opened, one sister was so upright and angry and furious and terrified. And the other sister couldn't lift her head up. And when she did lift her head up, she was absolutely heartbroken. You only had to look in her eyes and you could see her heart was absolutely broken. And I'd been both of those sisters caring for my mum. Quite often in the same day, I'd been angry, I'd been furious, I'd been scared, and I'd been absolutely heartbroken. And I sat down with them. And on their dining room table was a mass of correspondence about their mum, about someone's mum, of arguments, lawyers, disagreements, misunderstandings, and it was dreadful. And back at my house, there was a mass of correspondence about lots of people's mums and lots of people's dads. But they had more correspondence about one person than I had about hundreds. And it was a dreadful story. And I won't go into the details, but it was dreadful. And I got the train home and I couldn't stop thinking about those 2 sisters, and I couldn't stop thinking about this massive correspondence to get someone treated with kindness, dignity and respect, and allow someone to love and cherish and enjoy. And when I was going to hand over the letters to the Scottish Parliament with Irene, we invited 15 families who'd sent me letters to come with us. And about a month before it, I got another letter from the same 2 sisters. And it was the most beautiful letter you could ever wish to read. It was absolutely glorious. Same 2 sisters, same mum with dementia, which is a terminal condition. We have no cure. About a consultant, about the magnificent kindness and understanding of a new consultant who had turned a table full of tragedy back into a house full of understanding and love. And that's the difference that every single person in this room can make. That's who everybody in this room should be, aspire to be, and want to be. That person who takes time and understanding and helps keep a love story alive. And he's a remarkable person. It's a wonderful gift to have, and it's a wonderful gift to give. And I had the same experiences in caring for my mum. These engagements are absolutely crucial. This word loneliness. After caring for my mum, the door stops knocking, the phone stops ringing, people stop visiting. We lose our place in society the longer. And that's not about just dementia. That's about many long-term conditions. We get left alone. And these engagements we have with the people in this room are absolutely crucial. We absolutely need them. They might only be a 15 minutes engagement in a clinic, in our home, in a ward, at a podiatrist. But if these engagements are done wrong, that might be the only person we speak to for the next month. And it will knock us down, it will knock us to our knees. But if those engagements are done in the right manner, they will give us strength, they will give us hope, they will give us the ability to carry on. And I can't tell you how much that means. And I remember the people who engaged with us and made it better. And my heart is sad at the people who took no time to listen, who took no time to be involved. And then one of the most crucial moments in that was this beautiful, kind, dignified, magnificent woman. His dementia was doing everything to change and bring massive changes. Just as we thought we were getting the hang of it, just as we thought we were getting a routine, dementia would change everything. We'd wake up and everything we thought we knew the day before had completely changed. We had to start again. And I got up one morning to wake my mum up, and this magnificent woman had an accident in her bed. And my mum never asked to go to the toilet again. Never asked to go to the toilet again. And I didn't know what to do. I was in turmoil, and I got my mum out and I ran her a bath and I tried to clean her, but I didn't understand. And the whole time I was asking, how does Joan Whitelaw feel about this? How does my mum feel about her son seeing her in this delicate, intimate position? And how did I feel about seeing my mum like this? And I got my mum up and I got her pajamas on and I got her back into bed and I called to get help. And I asked for an incontinence nurse, which I won't go into, but I was put on a waiting list. 3 days later, someone delivered some pads to our house. I had no clue what to do with them. But I was put on a waiting list for someone to come and advise this wonderful woman who treated everybody with kindness and dignity and respect and worked hard. And I didn't know what to do. And I called the GP and I was calling and trying to get this support. But after a week of no one coming, my mum was starting to get a bit raw. She was doubly incontinent. And the GP organised a district nurse to come and give me some advice. And I called and she was coming out the next day. And I got my mum in the bath because I wanted my mum's hair to smell beautiful, because she always made her hair smell beautiful. And dementia should not be allowed to stop that. The fact that we need care should not be allowed to stop the way we lived our lives. And the door knocked and I shouted down and I asked who it was. And I asked and she said the district nurse, and I invited her up the stairs. And as I heard her walking up the stairs, I cried. I cried often in that 6 years, but I cried more than I'd ever cried before, because someone was coming into this moment that I didn't understand. I didn't know if I was doing it right. I didn't know if this was right for my mum. And she took one look at me. She took one look at me and she knew I was scared. She knew I didn't understand, and she put her arm around me. And she was the first person to tell me I was doing a good job. She was the first person to ask me, how can I help you? And she's a remarkable person. And if I walked out here today and I saw her, I would shake her hand and I would tell her thank you. Because before she walked up those stairs, I didn't know if I could continue to give my mum personal care. Half an hour after walking back down them, I absolutely knew I could. And that's a remarkable person to be that consultant, to be that district nurse that makes it better. An incredible person to be. And I know there's many in here like that, because I've met quite a few in the last year. and you should be celebrated. And we should celebrate the greatness of people who can make it better. Just before my mum passed away, she wasn't in hospital very often over the 6 years, my mum. But the last 5 weeks of her life, she was in 4 times for a few days at a time. She was very, very poorly. And on the last occasion when my mum got took in, I knew when my mum was coming home, she was coming home to die. Couldn't have that conversation. Nobody would have it with me. It was always, oh, it's just dementia. We can't really tell you too much because it's dementia. But I could tell. I'd been with my mum every day for 6 years, and she'd been my mother all my life. And I was terrified, and my mum was unable to talk, unable to walk, unable to swallow. She could swallow soft solids, but not liquids. It had to be a mixture in the middle. And this speech and language therapist was sitting with me. And I didn't say very much to her, but she looked in my eyes and knew that I was scared. And she came over to me and she said, your mum's coming home tomorrow. If you're ever really scared, if you don't know how to do this, here's my phone number. And I put it in my pocket thinking, I'll never need that. But that's amazing. And I got home. And when I got home and I emptied my mum's bag out and I got my mum settled, they forgot to put the mixture in the bag. They forgot to put it on the prescription. And it was a Friday, and it was about 3 o'clock, and I didn't know how my mum was going to drink or eat. And I asked my neighbour to come in and sit, and I ran up to the chemist I'd been going to every day for 5 or 6 years, and I asked them for this mixture. But they said only a hospital can prescribe it. I can't give you it. And I told them, it's a Friday afternoon, you have to give me this. And I called the GP from that chemist and I asked them for this mixture, and they told me only a hospital can prescribe it. I have to get in touch with the hospital. I can't prescribe it. And I was in tears again, and I stood there just not knowing what to do because I knew this was the last weeks of my mum's life. And I took that phone number out of my pocket and I called that speech and language therapist at the Southern General, and she drove to my house. She said, I'm just finishing and I'm coming over. And she drove to my house and she knocked on the door and she brought all these little gadgets and little tubs of mixture. And she sat there for 4 hours getting the right consistency for my mum. But she did everything more than that. She gave us hope. She let us know somebody cared about us, and she's magnificent. And that consultant's magnificent, and that district nurse is magnificent. But even in amongst doing that, nobody left my house without getting a campaign leaflet. Even the postman, when he put a letter through, I would post one back out to him. And I said to her, I'm doing a campaign from my bedroom. I'm trying to get people a bit more understanding. And off she went. And about a month after it, my mum had passed away. I got an email from her. And she said, I've spent most of my time in wards and not a lot of time in people's homes. But it was an absolute privilege to sit in your house, to hold your mum's hand, to help you, to be there. I'm so glad I met your mum. And I think she's right, isn't she? It's an absolute privilege to give that care, to help someone, to make it better. And it was an absolute privilege to have her as part of our lives. I'm going to read a short letter just now because I collect letters and people write to us, and the work we do is all based on the words of sons and daughters and husbands and wives. And I'm going to read just you a very short letter. And I know Irene will be asking me when I'm going to get a pair of glasses that don't cost £1, but I'm going to put them on. She has asked me that on several occasions. This letter came on the 3rd of March from 4 stops away from the expressway that runs across this exhibition centre. It says, Dear Tommy, I'm writing to see if anything can be done to help me. I am 80 years of age and my husband is almost 77 and he has vascular dementia. And life is very tough. It's very tough for me both as his wife and his carer. He is, I think, in the middle stages of dementia. As I said, I'm finding it very tough and there is no one here to share or help me get through this. I feel so very low and so very, very lonely. I need a human listening, understanding ear to help me. None of my family or friends seem to understand what we're going through. Only another carer or someone who understands dementia can help us. We have been married for 53 years and had such a glorious marriage until my husband took dementia. I am losing my husband. I am losing my marriage. Can you please come and help me? I don't know where to start with what's wrong with that letter. The very fact she had to send it to me is probably the biggest thing that's wrong with it, because I'm sitting feeling as lost and lonely. That letter should be, we have been married for 53 years. I've been chucked by every girlfriend I've ever had. That's a remarkable achievement, to grow, to fall in love, to meet someone, to bring up your children, to be left so lonely, lost and isolated. And if there's a person in this room who couldn't be that listening, understanding ear, you're sitting in the wrong room. You're at the wrong event. You're in the wrong job. If you can't meet that person and take time to listen and understand and allow that love story to not become a tragedy, and I hope that's what you do. I hope you go out here and back to the place where you inspire other people, where you meet sons and daughters and husbands and wives, and I hope you allow their love stories to continue. I hope you take part in their life stories. I hope you take time to listen. Because if you're going to be involved in someone's life, you have to be involved in the whole life story, not a prescription. No medication ever gave any more than that district nurse, than that speech and language therapist, than that consultant, to the person who stops people having to write such a sad and lonely letter. Well, that's my mum up there. That's Joan Whitelaw, and I'm going to tell you a wee bit about her, because it's really important you know something about her. My mum's name was Joan Whitelaw. She was born on the 15th of the 7th, 1939. Her mum died when she was 4, and her dad passed away when she was 7. And her big sister, who had a large family of her own, said, I will care for you. I will put my arms around you. I will keep you from fear. I will keep you safe. I will be there for you. To me, that's caring. A vulnerable 7-year-old child. I will put my arms around you. And that was the building blocks that made my mum the most kind, remarkable, caring person you could ever wish to meet. My mum understood how much it mattered to be cared for. That was the building blocks that allowed her to understand that. And she went out and she worked hard, and she met my dad, her only ever boyfriend, his only ever girlfriend, and they fell in love. And she made that wedding dress. They had no money, and she made it with her own hands. And I think she looked beautiful. I think she looked magnificent. And that was the beginning of a love story. That love story, it might not seem it at the beginning when your parents die, but when someone puts their arms around you and says, I will care for you, that is a love story. Then you meet a man and you fall in love, and that love story continues. And you have your children and you work hard to give them everything you possibly can, and that's a love story. And then my dad didn't keep well. My dad built ships in the Clyde, and he didn't keep well. And my mum looked after him. She also became the breadwinner. She went out and worked night shift to give her family the best she possibly could, for the love of her family. And I saw the greatest love story when my dad was diagnosed with cancer, and I watched them holding each other's hand, and I watched how much my mum was going to miss him. And when my dad told me, all that matters is you look after your mum. Nothing about him. He accepted it. Just make sure my Joan's all right. That was a love story. Then my mum got a diagnosis of dementia, and I came back to care for her. And that's where the love story became the biggest struggle of all, because it was too hard. I found it too difficult. Nobody was taking into consideration Joan Whitelaw. And when my dad passed away, I thought my mum was going to die of a broken heart. And I asked the question to this day, what is crueler, to die of a broken heart or not remember why your heart was broken? I know which one I think is crueler. Not remember the man you love is the cruelest trick of all. There is no crueler trick. And that's a really short description of Joan Whitelaw. It's a very brief description. But you now know more about my mum than anybody involved in her care for the last 6 years, because nobody ever asked. I don't recall anybody ever being interested in who Joan was, who she used to be, and who she would still like to be. And if you don't know what makes someone smile, if you don't know what makes someone sad, if you don't know what makes someone feel safe or makes them feel scared, then you can't truly say you're caring for them. And I hope you go and do that. I hope you go and meet all those Joan Whitelaws. I hope you find out what makes them smile and what makes them sad. It's been an absolute privilege to speak to you today. Thank you for your kindness. Thank you for listening. Thank you for understanding.